So x-rays, I don't know how to read them. I'm not a radiologist. The average radiologist could make up to $90,000+ a year. Now, these are some teeth, and I don't know what I'm looking at, but he's going to help us make it make sense. That thing was worn down a little bit.
So this was, I think this dog was 13. It was a big shepherd mix. But just like whenever we go to the dentist, it's kind of ironic because I went to the dentist this morning. So this is the crown of the tooth that we're paying attention to. These tracks going down, sometimes easier to see than others, is the pulp. So like whenever you are getting a root canal in a dog, cat, a person, don't matter, you are essentially killing all the nerve endings in this canal. So what we look at is we're looking at the bone all through here, all around the roots. We're looking at this very thin line around the root, which is where the periodontal ligament lives. And when there's more disease, that line gets bigger just because that ligament's not doing its job, the bone's going away. And then we really look right here is where the roots split. So we could take a probe on a really diseased tooth and put it right through that bifurcation. So this tooth, it's not the healthiest tooth in the world. It's not terrible, especially when we look at this tooth that was right in front of it. You can see how nice, pretty white all this is, and how like decaying look this has to it. In all reality, I kind of related this tooth to a cat's mouth because this tooth is getting resorbed. You can't hardly see where the roots were. It just almost looks like bone now. You can kind of make out the tips of it right now, but like in cats, it's called feline oral resorptive lesions, and we can't, when that's going on, it gets bad enough that we can't even get the roots out because it's just resorbed into bone.
So what do you do with the cat who's basically got teeth that turned into bones?
Yeah, so like if you look at this tooth right here, so here is the big one in front, and then the next one in front. See how this big old black area through here?
Yeah.
That's just decayed away, it's gone, it's not healthy. If this were a cat, and in all reality, it's kind of happened to this dog, mostly, is you would take your little bit and do what's called a crown amputation. So we just take that crown off and leave whatever's there of the roots. And like in this case, I mean, you can't hardly see them roots. I mean, they're essentially gone.
Yeah, in comparison to the other ones that you showed us there.
Right. And like here's a big canine tooth coming out. You can see how far they go down in here. I mean, canine teeth are not fun to pull. Here's the other one on the bottom. So this is the lower left side. The other one was the lower right side of this dog's mouth. Just dental x-rays are so important. You can see disease that may be present underneath the gum line, which is why our dentists take x-rays of our mouths.
That makes sense, man.
Yeah.
That's interesting. And mind you, people, I went and got my teeth cleaned. I had, I think gum disease is what they told me. And then the crazy part is oh, man, food used to store itself in my gums. And when they did the cleaning, I said, dang, that's crazy. I don't have to do that thing where I clean down in there anymore. And it's literally because they cleaned my teeth. And then they gave me a couple things to treat it with. But the question they asked is, hey, do you have x-rays? So I might have to go somewhere else to get x-rays, or they'll do x-rays free because they know they're about to do like this. $2,000 for that cleaning, buddy. We'll do them for free, or $1.99 or cheap, just because you're probably going to need, did someone tell you you have gum disease? I was like, nah, nobody tell me that. I ain't seen a dentist in 15 years. Literally, no exaggeration. Well, that's good then. So this goes back to, definitely this is like a pre-op thing objectively.
Yep, so this is on most of my patients, they're under anesthesia. I tell them go ahead and shoot the x-rays and then start cleaning them. I mean, really just like we're going to the dentist. The only difference is dogs and cats are under anesthesia and we're not.
And so we talked about, I think even off camera, all the areas and arenas that you can get into as a vet, and being a specialist even. What about adding a dental component to your particular place? Why was that important to you?
Oh, just because dental health is so important, and there are dentists around here. I know there's one 15, 20 minutes away in Plano. I know there's one in Flower Mound that I would refer to if like root canals or like some of your working dogs will get the crowns on their biting teeth just to help save those teeth. I know they could do something like that. Whereas I can usually do a pretty good job at the preventative health and simple tooth extractions.
Interesting. And this place, people, just to be clear, and meaning this room alone, it's here designed to help. It looks scary. You know, I don't know if you've ever seen the movie Saw. Look at that stuff there. I go, man. or what's that other movie with the hotel hostel? You go, man, something awful's going on back here. But it's here to, help your dog. And digital disease, I mean, I'm sitting here trying to absorb all the information I'm learning, but it goes back to even my own teeth. They were bad, man. And not bad like, it was just like the gums were bad. And once those gums get bad, it leads into a whole nother thing. So appreciate you sharing that with us.
Yeah.